slides after the call, so you'll just have to catch up a little bit later on that. I'm going to go over a few housekeeping things first as we get started. My name is Helen Hockey. I am the Executive Director for the Pennsylvania Coalition for Oral Health, and I am joined today by our Board Chair, Mrs. Jenny Englers. Say hi, Jenny. Make sure I can hear you.
Good afternoon. I think it's officially afternoon, and I want to welcome everyone who's joining us. And on behalf of our entire Board of Directors, we're pleased to have this level of engagement at the meetings, in-person meetings. Helen will talk more about as we move through the agenda, as well as joining us today for this brief update on all the great work that the coalitions and with all of our members and supporters and things we're accomplishing.
Thank you. So we have joined this meeting with everyone muted. It tends to work best that way for these online webinars so that we don't get a lot of background noise. But we do welcome any information you want to share. You're able to type into the Q&A chat box at any point. So if there's something that you have a specific question on, or we may wait till the end to answer, we're going to try to allow about 10 or 15 minutes at the end for any question and answer session. But feel free to type any of those questions in at any time. So as we move through the slides, you'll be able to kind of follow along on your screen. Our agenda for today, we'll just start by letting you guys know that we were fortunate to have almost 50 people registered for today's virtual meeting. And looking over the attendance sheet, it was really great to see we had a decent amount of managed care organizations represented, federally qualified health centers. We've got dental providers on the call, community groups, and some of our national partners as well. So welcome to everyone. And you'll see throughout the slides there are some of the information is presented with active links. You may not be able to click on the link during today's presentation, but on the slides that you'll receive afterwards, you can follow those links if you're looking for more resources and more information. And again, for those participating by phone only, I will try to recap a little bit of what's on the slides so that you're not completely lost as we go through the slides. But today's meeting in its entirety will be recorded and posted on our YouTube channel, so that if you have to jump off and miss something or you want to recap, you're welcome to go back and review. We're going to just talk a little bit about the work within our priorities, some of the victories that our state has seen to date in the year, as well as go over some upcoming dates for all of our stakeholders to get involved locally at some meetings that we're having. So we'll do our first quick poll here, and for those of you who have joined us in the past, you know how these work. We'll have the poll flash up on the screen, and there it is. And if you can take a second and just check one of the boxes, whether you've attended both on a virtual or in-person meeting. And I know we have some new folks that were joining us as well. So just click submit after you put your answer in, and we'll give that about another 30 seconds. And then Holly's going to flash up the results for us. For those on the phone, again, I know it's a little hard because you're not able to participate in the poll, but you'll be able to see it on the review. Okay, so Holly's going to put up our results and we will see where we're at. Okay, so pretty good diverse group. We've got a quarter of our attendees that have come to meetings in person, a little over half that have attended both styles of meeting, and then 13% that it's their first meeting. So welcome, we're glad to have you. And with that in mind, we'll be giving a little bit of a recap of some of the work. So for those of you who come to all the meetings and you're one of our groupies, as I call you, that might not be all new information, but still a good refresher. So as we move through here, of course, I have to mention our funding partners, all of the corporate and individual foundations and entities that sponsor us and support our work financially. I also have to mention, of course, our stakeholders that work and volunteer for this, for the oral health initiatives in our state. You know, it's a two-part process. We have to have someone to do the work, and we also have to have the funding to do it. So we're very, very grateful and thankful for everyone that's involved with helping us. So thank you all very much for that. And as we move through, I always like to remind everyone, for those who may not be aware, as part of our work that's funded through the DentaQuest Foundation, we work with 3 really amazing partners on the Pennsylvania Oral Health Collective Impact Initiative. So we work with the State Community Health Centers Group, the Pennsylvania Head Start Association, and the Pennsylvania chapter of the American Academy of Pediatrics. So I've listed a couple of their major initiatives here. If there's ever any more information you need on these subjects, we can connect you with the right folks. I did want to mention that PAC is having their Medical Dental Health Integration Summit, which is coming up on August 2nd and 3rd. So that information is available on their website. And we'll talk a little bit more about some of the other programs that the Head Start Association and the AAP are working on as we go through the slides. So mentioning the DentaQuest Foundation and their support of the Pennsylvania Oral Health Collective Impact Initiative is just one of the many, many, many national partners in the Oral Health 2020 network. So this group has been active for quite a number of years now. And as you can see, the goals that they're working on are fairly ambitious. One of the targets that Pennsylvania focuses mainly on is the goal of 85% of children reaching age 5 without a cavity. So that's a 2020 goal that we are working towards with the POCI group. And more information about all of the DentaQuest Oral Health 2020 initiatives are available on the oral health website, which you can see the link for at the bottom, and you'll be able to click on that later. So anyone who works on oral health initiatives is welcome to join the network, and we hope that you would want to get involved. So then moving on to our specific priorities, these are the coalition priorities of which many of you are aware. We mainly focus on oral workforce development, improving oral health for Pennsylvania's vulnerable populations, advancing implementation of the state oral health plan, and advocating for community water fluoridation. So the next couple slides, we're going to kind of divide some of that information up, tell you a little bit about the past work we've done, and then what we're currently working on. So of course, when we talk about oral health workforce, we have to mention our 2016 Workforce Innovation Summit, which I know many of you were a part of. It was really the catalyst for a lot of the programs and the work initiatives that we're seeing continue on. So on your screen, you can see a few of the prototypes that were developed at the summit and that we kind of maintained progress on throughout 2017. Many of these groups and work initiatives are still moving forward even now. So if there's something there that you specifically need or want more information on, or you'd like to get involved with, please definitely let us know. You know, it's one of those things that as we kind of move forward, we know that these are the kind of bright spots that have jumped to the top when we're talking about oral workforce development. So moving into 2018, Tella Dentistry has been probably one of the hottest topics. We've seen where we've got a couple additional groups that, you know, we did a pilot in the western side of the state. Now we've got some additional groups looking at some teledentistry models. Our oral health education in captive settings programs, spearheaded by Eve Kimball at the AAP, have been really, really popular. And I always say people don't realize that, you know, a lot of folks are kind of coming to these programs on their own, you know, where we're doing oral health education in waiting rooms and at community sites, but we have some resources available. So if you know of programs in your area that could use a little bit of help and additional resources, you know, we would love to connect you with those groups. And then looking at another hot topic right now is community health workers, so that we have somebody in the system who's trained to do care navigation and help connect people who need dental care with the providers who can give it to them. And to really establish that dental home, because that's what we need for both adults and children in the state. We're also working on a data project in collaboration with Temple to try to see not only the barriers, of why providers aren't always participating with Medicaid insurances, but places where, the numbers might not, we may see a situation where we know there are 10 Medicaid providers in a county, but maybe only 2 of those providers are actively seeing new patients. So we want to get a really accurate picture of the access to care situation in the state, and where we really need those workforce initiatives, we'll say. So that's something that we've kind of been working on and will continue to work on throughout the year. We're also doing a lot with our training for dental providers and medical providers and community workers as well. So we have a webinar portal that is available on our website, and these different courses are available through that portal. So completely free of charge. We just really want to try to get the most new and updated information out to the dental providers and medical providers. The special needs series is one that is up and coming. It should be posted very, very soon on the portal. And what's really great about our special needs series is that it was developed across multiple modules, so that depending on your role and the position you play in an organization, you may, self-select into different modules that fit what you're looking for best. So we're very, very proud of our webinar portal, and we welcome you to check that out, or to, refer it on to others who might be able to use it. Let's see here. And let's see, and I see Amy's letting us know that the portal was having some issues this weekend. So hopefully it looks like we'll have that back up and running on Monday. So please don't run to the portal today, but it is something to put on your calendars for maybe when you return back from the holiday break. Okay. And so moving on to improving oral health for our most vulnerable populations. This is just a recap of some of the work we did in 2017. We started doing some more active work on advocating for the comprehensive adult dental benefit. We've had a series of meetings, in Harrisburg, trying to meet with all the right people to really push for the importance of that comprehensive benefit. For those who may not be aware, Pennsylvania did have a comprehensive adult Medicaid benefit, which had a series of cuts in 2011. So some of the more comprehensive levels of care are no longer covered, just as a matter of standard process. So we're getting some national assistance from the Community Catalyst organization and DentaQuest to work on that. We've got a really great work group that we work with. And then another big campaign that we had last year is we had a really large, widespread media and print campaign that focused on oral health and pregnancy. Something that we're very proud of is that work was selected to, we're going to be doing a poster presentation at the American Public Health Association conference in November this year. So it's a really great way to highlight oral health on a national level, and specifically oral health in Pennsylvania. So moving on to this year, some of our work under this priority, we were able to, through some Department of Health support, award 6 mini grants across the state, focusing on both education and clinical programs to allow, an expansion of care services for some of the organizations. And I'll talk a little bit more about that on another slide. We've seen some growth and progress with our medical assistance advocacy work group. one of the things that we looked at was the data of emergency room utilization. So we found out just at a bare minimum that looking at just primary codes of dental issues in the ER, that Pennsylvania spent about $6 million in 2016 on dental services in the ER, which, as many of you are aware, that is mostly palliative care and does not actually fix the problem. So we see a lot of repeat visits in emergency rooms for dental care, and we see a lot of opioid prescriptions issued. So that's something that we really want to try to correct if possible. Another kind of situation we're looking at are some unintended consequences of the cut in adult benefits. Something that happened that I don't think anyone was really predicting was that many of our dental schools rely on patients who participate with medical assistants to come into the dental schools and have their work done. And what has happened is that as these benefits were cut, the schools are now no longer able to meet the same patient qualifications and numbers for the dental students. So we're seeing a situation where the number of services provided before a dental student graduates have had to be cut back drastically. So that's something else we're looking at across the state to see how to kind of assess that and see where we can use that information to really advocate for the restoration of the benefits. And again, for those of you who work with Children's Dental Health Project, you know that they have really kind of shifted to this multi-generational approach, where we know that kids that live in households where the adults don't get dental care are now not, getting as much dental care as the ones who do. So we know that adults getting dental care and comprehensive dental benefits will lead to more kids getting dental care. So that's kind of a change in focus, I think, over the last few years. And then we're hoping to make maybe a formal ask for some legislation to restore the comprehensive benefits in January when the new session starts. So that's been some pretty great work. We work with a lot of partners across the state on that, and it's been really, really rewarding. So specifically focusing, we're looking at doing a lot of work with the Perry County Oral Health Work Group. It's been a good project. We're working with the county commissioner and the health consultant there, and we're not only going to be reaching out to the dentists in the area about ways that they could be more involved, possibly joining the Pennsylvania Dental Association's Take 5 program, where they would agree to see just 5 Medicaid families. That would be wonderful. But we're also looking at ways to address the workforce issues there as well. So that county only has about 11 dentists right now, and definitely in need of some more. So we're trying to make the connections with local high schools and promote dental careers. Since we know that specifically in rural areas, the best chance we have for adding new dental providers is to kind of grow them from the ground up from within the community. So that's been very, very enlightening work, and we're doing a survey there as well to see where the greatest needs are. And then we've assisted with a lot. Every day it seems like we're getting more and more information about new oral health task forces, and so we're trying to be a resource and provide any information that we can and support that we can to those local groups. So if you know of something in your community that maybe we don't know about, please let us know. We would love to get involved. And of course, I wanted to show this map. This slide shows basically the reach of community health centers, which really are the safety net for a lot of the underserved adults and kids in our state. We've seen a great growth through a lot of the Pennsylvania Association for Community Health Centers dental work. We now have 92 dental sites within the federally qualified health centers in Pennsylvania. And many of you who work and know about rural health know that we usually call Pennsylvania, we have the dead zone that we call the T, which is the whole northern tier and then the center of the state, because the Pittsburgh and Philadelphia areas tend to have a lot more providers around. But it looks like to me, when I look at this map, I see that we're starting to see a little bit of a shift where maybe it's more of an I and not so much of a T. So I'm glad to see that, and we will, of course, be trying to help the PAC group do and add as many more dental sites as they can within their existing facilities. Moving on to our state oral health plan. So our state Department of Health has written and published a formal oral health plan. That plan is available on our website, so if you want to review, I believe it's 72 pages in final form. So anybody is more than welcome to look over that plan, and if you see an objective or part of the process that you can be a part of, please let us know. Our responsibilities within the oral health plan are listed on the slide here. We're administering the mini grants, we're helping them hold their regular meetings, as well as distributing progress reports and newsletters for the plan. Eventually, probably into 2019, we'll be using livehealthypa.com, which will be a platform for the work groups. And then we assisted with grant submissions, both for HRSA Oral Health Workforce Grant and a CDC Capacity Building Grant. So hopefully we will be finding out in late summer if Pennsylvania has been awarded those grants. And some of you have seen this slide before, but it just always is good to share again in terms of the 3 identified priorities within the state oral health plan. We're mainly looking at access to oral health care and prevention, oral health workforce development, and oral health infrastructure. So those are the 3 main groups, and all of the objectives of the plan kind of fall into those different areas. So we're tracking the 10 main goals and making sure that we're working to meet those objectives as we move forward. So an update on the plan, the final version was publicly released in February. PCOH is tracking all 10 of the objectives / goals. We will be sending out an application or posting an application for our next round of mini grants, which should be a little bit later this summer, which will be at least, hopefully we're hoping to award at least 4 grants for the 2018-19 year. And our current grantees are listed there. Almost all of those programs were on increasing education as well as clinical services to the communities that those folks serve. So we just got our reports back in this week from everybody, and it's been a really, really, it's been very heartwarming to see all of the good work that all of these groups do. So we're hoping to have that information out in a report form for everyone over the next month or so. And, one of the big things that we know as a state is that we have a lack of data. So we've got to really establish that the baseline numbers for all of these different kinds of programs before we can really assess the work that we're doing and the goals we want to achieve. So we're doing that over the next few months. We'll have our baseline numbers put together and then continue to track progress under the plan. So moving on to community water fluoridation. At the last time they ranked us, we ranked 41st in community water fluoridation reach, which is not the greatest. We have a lot of work to make up for in our state. We were able to publish our community water fluoridation brief and infographic last year. We addressed 3 different issues that came up, both with Meadville voting to add fluoride and Johnstown and Ebensburg both debating whether or not to remove fluoride. And we were successful in 2 out of 3 of those areas, which we're very happy with. And a lot of that came from our community water fluoridation team. So back in 2015, we had trained a community water fluoridation team so that we have kind of an army of resources available to us across the state so that they can provide testimony, when we have issues pop up in areas. So we'll do another quick poll just as a curiosity poll to see how many of you live in an area where your water is fluoridated. So you'll see it on the screen there. So if you'll go ahead and answer the questions there. We made the poll, we put an option for well water in the poll because, as many of you know, I think it's almost 2 million of our residents have well water, and so well water has naturally occurring fluoride, but in Pennsylvania it's not at the limit that is optimal for the teeth. So essentially, if you live in an area where you're served by a well, you're not getting the benefits of really getting water fluoridation. So, and we'll have another 10 seconds there to answer the poll. And then we'll have Holly go ahead and put the answers up for us. Okay, wonderful. And yeah, so as you guys can see, only a quarter of you answered that yes, your water is definitely fluoridated. I will tell you one of the goals for Healthy People 2020 as a national goal is that 79% of us would have access to water that is optimally fluoridated. So 25% is definitely low. And 20% on the call have well water as well. So thank you guys for that. It's always interesting to see. And then I wanted to show this map. I know we just shared this 2 weeks ago at our Erie meeting, but this is a pretty good indicator to show. Again, you'll see the T that I mentioned, where we have this kind of zone across the top of the state and through the middle where, you know, there's not a lot of access to water that's been optimally fluoridated. So that's something that we're looking at, and we really are trying to get changed. We'd like to see some differences coming up there. So there's a quick slide of our brief, which we can provide copies of if you guys need for any kind of promotion you're doing in your communities. And then talking a little bit more about the work that we've done this year. So we had a meeting last week with the DEP and the Safe Drinking Water Bureau. And one of the main goals of that meeting was for not only PCOH, but also the Department of Health to start to learn more about water systems. What's considered a water system? What are the regulations that, you know, really affect the water systems? And then which ones might be the best options for promoting community water fluoridation? So we know that out of the, you know, top 200 counties nationwide that are not fluoridated in terms of size and population served, that 14 of those 200 are in Pennsylvania. So that's a really big deal. We know that there's potential to really help a large group of population with just a very small amount of you know, water systems served. So that's something that we're looking at. We're trying to get more information on, and we were invited to speak at their advisory committee meeting in the fall, which I'm really thrilled about, because I think that our connections with the water operators and the utility commissions and the water authorities are really the one path that we can use to promote optimally fluoridated water. And I listed those bunches of acronyms there just to confuse everybody. But if I spelled them out, the slide would have been, you know, 3 slides long. So that's the Pennsylvania Municipal Authorities Association, the Pennsylvania Waterworks Association, and the Pennsylvania Rural Water Association, which are 3 groups that we are starting to talk with, planning to exhibit at their conferences, again, in order to develop those relationships with the water operators and the water authorities. So we've been distributing our fluoride brief. We participated in a couple school conferences, and we've been able to share that fluoride brief there, as well as through different networks locally in different regions. Another one of our kind of sister states, the Kansas Oral Health Coalition actually developed this SWAT program, which we would love to implement sometime this fall. And so SWAT stands for Statewide Water Action Team. So this would be a way to send out, you know, a little letter and a clever little magnet to all of the dental providers and medical providers in the state. Because one of the biggest kind of hurdles that we have is that a lot of times by the time we hear that water is going to no longer be optimally fluoridated, it's too too late because, you know, the meetings have already been held, the permits have already been filed. So we really need to find out about some of these concerns and issues before it gets to that point. And the way to do that is to really have a boots on the ground team. So not somebody that has to do anything else any other part of the year, but just that if they hear some rumblings about fluoride, that they're able to give us a call right away and allow us to go in and do our education and advocacy. So we're also talking with a group. There's a group called KC Industries that's working on a really innovative new tablet system, because a lot of times the water authorities are not as keen on the fluoridation systems because, of course, concentrated fluoride, just like concentrated chlorine, is difficult to work with. So there's a new system that is still undergoing the second round of processes to get approved, you know, that we would be able to use it in Pennsylvania. But what's great is it's a very safe tablet system, very small, only takes up a couple feet of space in terms of a footprint on the floor, and costs only, for most systems under 10,000 taps, it would be less than $5,000 a year to maintain and provide tablets for. So we're really, really hopeful that that could change, kind of change the game for some of the smaller systems that may want to fluoridate, but have not been able to because of cost. So some other news for the coalition. We updated our website in the spring. We are now, in terms of the folks who are subscribed to our newsletters and that participate in our meetings, we now have more than 580 stakeholders, which has just been amazing. We have almost doubled our stakeholders in the last 18 months. And we're really, really excited to see that. It's actually starting, I said we need a map. We're going to need a map pretty soon to know where everybody's at and what they're doing. We implemented our stakeholder spotlight, which I know many of you have commented on and said that you have appreciated receiving. So if you know of anyone who's really active in oral health and you'd love to see them featured in our monthly stakeholder spotlight, please let us know. Just recently we did a direct mailing out to all the dental providers in the state, because we realized that out of the 18,500 dentists, hygienists, and expanded functions dental assistants in the state, probably less than 1% of them are really aware of what the coalition is working on and some of the public health, oral health initiatives. So we wanted to give everybody some background information on the coalition, direct them to our website, and hopefully ask for their support. So we have received a lot of feedback from that already. And I will say, you know, for anyone, you know, if you have something to talk with us about, please let us know. We're always willing and able to discuss the work that we're doing. We had a couple responses back from the mailing where folks wanted to remain anonymous, but we weren't really able to answer their questions then. So I want to make sure that, you know, if there's an issue or a concern that you have, please do let us know. And we've been looking at the mandated school program, of course, over the last year, talking about revising the school form, what are the best practices, and we were really pleased to hear in Erie some concerns about the information that kids take home from that mandated school program. Namely because, you know, many parents kind of think that their child seeing the school dentist is a dental home. And so we're now looking at ways that we may be able to change that disclosure that goes home to make sure parents are aware that having a mandated school screening does not necessarily mean their child has seen the dentist and is all good. So we're working on that, and that's something that I think we'll be able to implement fairly soon. And then lastly, one of the other major things we're doing this year is holding our Pennsylvania Oral Health Summit, which will be focusing on getting all of our stakeholders kind of in a room and able to start sharing, connecting, and collaborating across the state, because we know that there are so many good things happening, and we hear, you know, little bits and blurbs about all of them, but really our true power comes from sharing that with others who can then implement that in their own areas. So we want to make sure the people who need to be connected are connected. So that's some of our major initiatives and kind of news for 2018. And then moving on to just not necessarily coalition successes, but successes that we have seen in our state, which yeah, I'm very, very excited about. The Centers for Medicaid Services report, they have a 416 report, which I'm sure some of you are familiar with. And one of the things that they measure is the number of children who receive medical assistance who have had a preventive dental visit in the last year. And that's kind of been a benchmark for a lot of different groups to look at. In fact, our state health improvement plan through the Department of Health, that was one of the goals and objectives that they listed. And so what they wanted to see was an increase. In 2014, that percentage was 42% of kids had received a preventive dental visit in the last year. So they set their goal at 47%. By the end of 2020, and I was so excited to see that we smashed that goal and went right on through in half the time that we had allotted. So our 2017 numbers are looking like 48.8% is actually where we were at. So I think we're going to need a new goal for 2020, and dare I say it goes over 50%. That would be great. So that's something that I'm just very, very excited about. I think it really shows that our state is moving, and that's really from a lot of different kind of guidelines, different people weighing in. You know, that's been the work of the managed care organizations, and that's been the work of you know, the groups here that, you know, do education. Our POCI group, I would love to say, has had a lot to do with that in promoting age 1 dentistry and cavity-free kids. So just some really great stuff. We've got medical providers referring to the dentist more often. So that's a really great information. Then, of course, obviously, the oral health claim being released was a super great accomplishment for 2018. This Senate Bill 780, for those of you who aren't familiar, it's the telemedicine bill. So it's recognizing telemedicine, which includes Tella Dentistry. And we were very fortunate to see that it passed the Senate about 2 weeks ago. I'm doubtful that it's going to move by the end of the year at this point, because we know that the fall session for the legislators is going to be extremely limited with the election. So I'm not real sure where it's going to go in the fall, but we're going to continue to track it, and we were thrilled to see that it did get past the Senate. So let me see here. And then, so the Medical Assistance Advisory Committee is a group from the Department of Human Services that works on different issues across the spectrum for the Office of Medical Assistance programs and some of those different groups. So they appointed a dental subcommittee last year to really look at some of the dental implications in our state. And I was very thrilled to see that at their May meeting, the subcommittee came back with some recommendations. Two of the big recommendations, one was that all managed care organizations would accept a universal document for credentialing, so that rather than having different credentialing processes for everybody, that they would be able to have one universal document. And then another one was that it's always kind of been a headache to get credentialed with medical assistance. Sometimes it takes a long, long time. I've even heard up to 6 months and more. So one of their other big recommendations was that all clean applications would be able to get passed through and processed in 60 days or less. So that's two really big monumental shifts that could help, particularly with getting more Medicaid providers approved in the dental community, and then more access to care for the patients who need to use that insurance. So that's been a really kind of neat thing that's coming up. And I know by I think they're trying to move ahead with some of those recommendations, and we'll know more at the July MAC meeting how that's going. And then lastly, which is not lastly, but so important, is that our state Department of Health formally submitted 2 applications, both to the HRSA Oral Workforce Grant and for the CDC Capacity Grant, which those 2 grants, we will find out in August if they've been awarded to Pennsylvania. If they would happen to be awarded to Pennsylvania, that would be an influx of almost $3.5 million over the next 5 years into the state oral health program. Which would be monumental. That's always been an issue, is of course, in order to conduct things statewide, that you have to have funding to do so. So we'd love to see our oral health program grow at the state level. So that wraps up with the victories that I know about in 2018. I have a question here, and this is not necessarily a polling question that I would expect everybody to be able to answer via poll, but if there's anything that you know about that's happening in our state that you want to share with others, and you want to type that in the question and answer box, then we would love to celebrate that with you. So I think that is great. Let me move on to our next slide here. And so ways that you guys can get involved, and many of you have already done this and continue to do it, so I really appreciate that. We did start a new process because we've collected various amounts of information about everybody through the years, and we have decided that it was time to really compact that into a new database. So we have a new way to kind of update your stakeholder information so that we know, which group you work with and what your role is in that organization. What kind of key topics are you interested in? So that if we have a situation where we need some input on a school sealant program, we'd love to be able to go to our database and say, okay, who's interested in school sealant programs? And be able to pull up the folks that the information is most relevant for. So if you haven't had a chance to update your stakeholder information, please do that right away. And again, when we send the slides out, that information will be there, so you guys will be able to share it. And then, always, we welcome everyone at our in-person meetings. And then if you know of something going on in your group that PCOH should be involved in, please, please, please share it with us. We're just constantly collecting information, and we really want to be able to keep collecting and collaborating with all the different partners. And then, of course, our 2018 appeal, as I mentioned earlier, it's not only our big corporate sponsors, but it's everyone who's able to give anything that they can, whether it's financially or just with their time. We appreciate everything, because it really does help us do our work. And Amy, I'm seeing, that's right. So I'm going to share Amy's news with everyone, especially for those on the call that might not be able to read this. That's PA Head Start Healthy Smiles Task Force has honored 2 oral health champions this year. So Dr. Deep Shaw and Dr. Brittany Knoll. And so in the Northeast, they're going to be there on November 1st for their Healthy Smiles Task Force. So if you know of an oral health champion, particularly one that works with Head Start populations for that area up in the Northeast, please definitely let Amy know. And if you don't have Amy's contact info, you can let us know and we'll pass it along. So thank you, Amy, for that. And so upcoming meetings that we have going on, I did post, we have our Pittsburgh meeting coming up August 10th, which will be an all-day meeting, and we'll also be helping to host the Department of Health stakeholder meeting that same day. And then we'll be returning to Scranton. We haven't been to Scranton in a while, so we'll be returning to Scranton September 21st. And again, that'll be, a half-day meeting with us and a half-day meeting with the Department of Health. So we welcome, if that's your area, please join us. And then our next virtual meeting will be December 7th. So that's something to mark on your calendars, especially if you're not able to make a live meeting this year. It's hard to sum up everything into 1 hour. So again, if there's something that you want to learn more about or you want to discuss further, let me know. And I put up our date for the Oral Health Summit because that is coming up in the fall. That's going to be in Harrisburg, and we're expecting a lot of interest for that. So our registration will be coming out either late summer or early fall. But our sponsorship opportunities are available now. So we want to give everyone the opportunity that wants to do more of a corporate sponsorship. We want to make sure they have maximum exposure so that, you know, their names and logos are on all the materials moving forward. So if that's something that your organization might be interested in, you know, please definitely check that out right away. And I am, of course, have to mention all of our social media touches. Once you get these slides, you'll actually be able to direct click to the sites, so that if you're not following us on Twitter or if you don't like us on Facebook, please be sure to do that. We try to share, we send out our newsletters a few times a month, but we also do share quite a bit of information on social media. So if you want the total picture, that's probably the best way to do it, is to follow us on those sites as well. And again, you can call and email me anytime. I'm always happy to discuss what's going on in your neck of the woods and anything that we can help you with for that. So with that, I am going to see if, I'm not sure if Jenny has anything else to add, but it looks like I timed it that we have exactly 14 minutes for questions. If anyone has any questions or comments or anything they want to share. I wanted to add, we actually, on our last virtual call, we had one of our stakeholders suggested a project, and we were able to pass that on to one of our partners who is now kind of running with it, which was a oral health education in food pantries project. So we're really excited that the folks at the American Academy of Pediatrics are looking at implementing one of those programs. So comments and suggestions that you make, we definitely do take very seriously, and we'll share as much as we can and get them moving. So, so the Temple collaboration in regards to getting data on the barriers to providers signing up with MCOs. So specifically with the Temple group, I know I mentioned looking at the data more so in terms of providers, but the barriers to providers signing up with MCOs, we have a student that's working with Dr. Marisol and Dr. Vinod there. And so I can give you that information too. I can email you guys their contact info. But what they're going to be running out, and they're actually waiting for IRB approval right now, but they're going to be sending a survey out to a sample size of dentists, which is actually very specifically going to ask all the different reasons that a provider may not want to sign up with a managed care organization. And so that should probably go out sometime in the next month or two in terms of a mailed survey. And we're hoping to have that data back by the end of the year. And we will gladly share it as soon as it's available, because that's definitely important information, and we want to make sure that if there's a barrier we can address, that the managed care organizations are able to do that. So I hope that answered the question, and if it didn't answer it enough, then please feel free to contact me after, and we can talk. So any other questions, anything, Jenny, any input from you, anything you wanted to add?
I'll just add a brief commercial for the Fall Summit. I know that you made an announcement about it, but being on that planning committee and actually just having had a call this week really stoked my enthusiasm, and I want to pass that along to everybody. I think we're going to have a really great meeting and really building on our efforts of 2 years ago and everything that's happened in between, but with some new twists. And I think that it will really be an engaging and actionable meeting, and that will happen because we have great participants as well as all this great planning that's going on. So please put the date on your calendar, and also think about your own circles, people who may be able to lend something to the conversation and encourage their participation.
Okay. Thank you, Jenny. And one other question that popped up here, could you please share more information on mandated school programs, and only 3 different grade levels require dental clearance for school enrollment? Yeah, it's interesting, and I'll try to do the 5-minute summation of the school programs, because many states don't require a mandated school exam or screening. We're one of the very few states that require it. It is only required, it's upon entry to school, which could be K or 1, so each school district kind of does their own thing with that one. So it's either kindergarten, first grade, and then it's third grade and seventh grade as well. So it is only 3 specific grade levels that they're required to have the mandated form. The problem is, you know, it would be great if it was mandated for every grade level, but the issue is that most of the kids that need the most amount of care, whether they get the form filled out at a private dentist or whether they rely on the school dentist to fill out the form, there still isn't any repercussion for not following up. So even if you require it for every grade level, that puts a heavy administrative burden on the school to do the paperwork, but I don't know that it necessarily gets any more kids into care. Because they really, there is, you know, the school nurses follow up a couple times for the programs that utilize the school nurses for that, but there's really no repercussion to the parents. So I would love to see a better situation, and I, you know, obviously it's pipe dreams here, but you know, we have the exclusion groups, like, you know, for vaccines, where you're excluded from school if you don't have your vaccines. So, you know, in my dream world, you could set up an exclusion for not having the dental care taken care of. But again, I don't know how effective that would really be on a wide scale. So yeah, it's one of those really interesting things. And I will say that we're looking a little deeper at that. We're not real sure. We had applied for a grant that we haven't heard back from to start looking at the policy around the school programs. So hopefully if we get that, we would be able to delve a little more deeper into this and see if we can find out more with those mandated school programs. So yeah, it's, again, it is only required for those 3 grade levels, and making it required for each one may not necessarily help the process. And Eve is commenting that we have to get the oral health education in the schools because we have parents and, you know, families and kids that have very low oral health literacy. And something that, you know, I would be remiss to not mention is that, you know, back in the 70s, we had, you know, almost 400 of the school districts had school dental hygiene services programs where they had a hygienist in the schools as an employee doing education at every grade level. That number has dwindled in the decades since then. And right now, looking at the 2018-19 school year, we only have 36 of the 501 school districts in the state that will have a dental hygiene services program. So, you know, we've kind of, obviously it's budget constraints and everything else that have kind of led to that, but we don't have a lot of great access to the kids in schools. So that's something that, you know, we're definitely watching and keeping an eye on. So, and yes, and Eve is mentioning, and that actually is a great 2018 success story. Eve's medical practice has done a whole lot of work with hygienists in their community, and so they have 2 educational hygienists that actually touched 18,000 kids in the school year, in this past school year in Reading. So yeah, there's definitely potential for getting that education into the schools and raising that oral health literacy. So. Okay. Any other questions, concerns, anything else going on? I'm not seeing a lot of other things pop up here, so we'll give everybody about 30 more seconds to raise their hand now, or forever hold your peace. Well, not forever, just until we're done with the call, and then you can email me about it. But I think that wraps up everything for today. I'm not seeing any more questions pop up. Again, I would share, oh, there's somebody in the chat box. The agenda for September's meeting, still working on, but I can share that with you, Dr. Say. I'll make a note to make sure I share that with you soon, so that it may not be a completely fleshed out agenda, but I will make sure we get you at least a bare bones agenda over the next, probably in the next couple weeks. So I'm just going to make a little note here and we'll get that over to you. Okay, sure. All right. So All right. Well then, everybody, I will give you back about 5 minutes of your day, 6 minutes of your day. And again, this will be, the recording will be on our YouTube channel. If there's anything else you want to go over, and we'll send the slides out afterwards, feel free to reach out. But I really appreciate you guys taking the time today to listen to us and learn more about the coalition. So thanks, and have a great holiday weekend.